Hello, I'm Nisreen. I'm one of the doctors in the clinic today. Can I confirm your name and age, please?
I'm Robin Walsh and I'm 41 years old.
Hello, Robin. I believe that you are here today because you have some symptoms related to your water work. Is that right?
Yes.
So, can you tell me more about it?
Yes. One of my symptoms is intense pelvic pain below my belly button.
Mm-hmm.
I also have a sudden strong urge to pee. I need to rush to the toilet. I also think I go to the toilet more than normal, and I have to wake up at night to go to the toilet.
Okay. And since how long you have been like that?
Around 3 months?
Okay. And any other symptoms at all?
No.
Okay. So I'll address your concerns in a moment, but before that, I need to know more about you. So can I ask you a few questions to know more about you?
Yeah.
Yeah. So in relation to your symptoms, let's talk about one by one. So you told me you have some pain in your pelvis. Can you tell me more about it? What can increase that pain and what can decrease it?
Well, my pain is relieved when I pass urine, and it's very severe when my bladder is full. It
Mm-hmm.
also increases during my period and when I eat certain foods or drinks.
Okay. And you told me that you need to rush to the toilet. So, do you wet yourself during that?
No.
So, you told me also that you are going, like, to the toilet more than usual. So, can you tell me how many times roughly during the daytime?
Around 10 per day.
And also, you told me you have to wake up during the night time. So, that happens roughly how many times?
Around 3 to 4 times.
Okay. And whenever you cough, sneeze, or laugh strongly or strain, do you wet yourself at all?
No.
Okay. And in relation to your gynae history, can you tell me more about your periods?
They're regular and they're minimal in amount because I'm on mini pills.
Okay. And you are sexually active.
Yes.
And any problems during the intercourse or like, pain or bleeding after intercourse?
No.
No. Any bleeding between periods?
No.
Okay. And any discharge from down below?
No.
No. And any time you have been diagnosed with any infection in your pelvis or sexually transmitted infection?
No.
No. And what about your smears?
My smears are up to date and they're normal.
That's good. And have you ever been pregnant before?
Yes, I've been pregnant once.
Yeah. And did you? What was the mode of your delivery?
Normal delivery.
Okay, that's good. Any complication at all during your delivery time?
No.
No. And otherwise, you are medically fit and well?
Yes.
Okay. Do you have any surgeries in the past in your tummy or from down below?
No.
And any allergies?
No.
No. And you are taking any medication for anything like in a regular basis for chronic problems?
No.
No. And do you smoke?
Yes.
How many roughly a day?
3 per day.
Okay. And do you drink alcohol?
No.
Okay. Any recreational drugs?
No.
Okay. Um, are you aware of your BMI, which is the relation of your weight to height?
Yes, it's 37.
Okay, that's good. So, actually, Robin, these symptoms are a little bit vague. We need to do some investigations, and you need to do what we call the bladder diary. That's to record whatever you are taking from fluids in and how much your fluid output. And that can be run over 3 days. And then when we look at it, we can, know what is the main problem for you.
I actually already did this with my GP, and he thinks that my main problem is pain associated with my water work.
Oh, I'm sorry for that. And I believe that also your GP has done a urine test for you.
Yeah, he took a sample and he found some blood cells and white blood cells, and then he sent the sample for further investigations. which came back negative for infection.
Okay. So, Robin, I believe that we are facing a condition called painful bladder syndrome, in which we have pain mainly during your bladder filling phase, and that's associated also with frequency, which is going to the toilet more often, and also urgency, and also passing urine more often during the night time. Actually, there are some differential diagnoses for your condition that includes endometriosis, and sometimes maybe there may be abnormal cells in your bladder. However, the endometriosis is not obviously present in your symptoms because you don't have any problems during sex or any pain, and also you are taking progesterone, the many pills, which is shutting down your ovulation, and thus your symptoms are still present. In relation to exclude the presence of any abnormal cells inside your bladder because you have some blood in your urine, we need to refer you to what we call cystoscopy, which is a camera test. We insert the camera through the water pipe, which is draining your urine outside from your bladder. And with that camera, we need to have a look inside your bladder. Sometimes we may need to take a sample if we think there is any pathology or polyp or any any suspicious lesion found, and sometimes we may diagnose the condition with interstitial cystitis or bladder pain syndrome. So usually we may need to take another urine sample from you today. We need to send it for urine cytology. That's to exclude any abnormal cells, and also we need to send it again for investigation for infection with non-usual microorganisms like TB, mycoplasma, and chlamydia as well. So that should be done today, and then we refer you to the cystoscopy or the camera test. So if we diagnose a condition called bladder pain syndrome and we excluded other pathologies that may be present in your bladder, we need to do our management depending on that. So I need to refer you to the physiotherapy to do some bladder training. You have to avoid the triggering foods and drink that's increasing your pain, and also to do some exercises, especially the stress relieving exercises. If this lifestyle modification, one of them is to try to reduce your weight a little bit, because the BMI is a little bit on the higher side, and also that can increase the problem. If all of that done and it didn't help you, we may consider giving you some medication that may include some antihistaminics, cimetidine, amitriptyline, and sometimes if all medications are not working, we may consider surgical option. The surgical is we can during the cystoscopy itself or the camera test, we can put some drugs inside your bladder, like hyaluronic acid or chondroitin sulfate. Sometimes we may put blood thinning agents like heparin inside your bladder, and sometimes we may do what we call the hydrodistension. And the last resort is to do what we call surgical reconstructive surgery, is to do augmentation cystoplasty or partial cystectomy, but only these can be done after MDT discussion, and also when it is not relieved by anything. Okay.
Okay.
So that's all of our management. We are going to investigate for it, and we will take it from there once you have the cystoscopy done.
Okay.
So do you have any questions so far?
No.
Okay. So I'm going to do the referral forms now to the physiotherapy as well and to the cystoscopy. I'll take your urine sample and I will give you patient information leaflet. I also give you some contact details. If you need to contact us at any time, feel free.
Yeah, that's great.
Thank you.